So, carrier screening is a test that looks for changes in our genes that can be passed down. And the really key thing about this particular test is that it can be done at any point in pregnancy and even before you're pregnant. So, what it's doing is that the test is looking at multiple different genes and seeing if there's any genetic changes in them. The key thing to remember with this test is that if you're found to have a genetic change in any of these genes, the next step is to have your reproductive partner screened. And the reason for that is because we each have two copies of our genes. One we get from our mom and one we get from our dad. So if there's a change in one copy of the gene, that means that you're a carrier. And most often, carriers have no signs or symptoms of being a carrier. So oftentimes, you have no idea that you are a carrier until you actually get tested. But what matters is that if both you and your reproductive partner are a carrier, then there's a 25% chance a child could inherit that condition and be affected with that condition. So, a couple key points. What I love about this test is that it can be done even before you're pregnant because it's getting genetic information on you, not specifically the pregnancy. There are different size panels. So there's multiple different labs that offer carrier screening, and some panels, meaning the number of genes that are on the test, are called panels. They can vary from looking from 20 conditions to 500 conditions. So the more conditions you test for, the higher chance that you'll be found a carrier for something. So it's a key thing to remember that it's actually normal to be told you're a carrier for something, especially when you're testing on a really large panel. One of the questions I get often from my patients is there's absolutely nothing in my family history. Everyone's healthy. Do I even really need to do this? Um, and the answer is yes, because most often we won't even know that there is a family history when you're a carrier of something. So, one way to think about it is if you're a carrier, it means that one of your parents are and that their parents are. And for generations and generations, someone's been a carrier in your family. And the only time it would really show up is if both someone who's a carrier and has a child with someone who is also a carrier. So, for generations, it can be silent, so to speak, and you would never really know. The other thing I really want to point out is that if your results come back as screen negative, that's super reassuring. And, we wouldn't really anticipate any increased risk, but a negative result doesn't take away all risk. We would never say the risk for that condition is zero. And that's because for a number of reasons. It could be that the testing that you had didn't look for all the genes, the technology didn't pick it up, or even sitting here in 2024, we might not know all the genetic changes that cause some of these conditions. So for those reasons, it's important to always kind of go into it with the mindset that if the screening is negative, it's reassuring and that you've kind of done as much as you can at that point. But there's no one genetic test that'll take away all risk.